Well, let me just say a quick word about the work of the Arts Alliance. I represent an organization that serves artists and arts organizations. Our primary charge is to elevate the presence and importance of the arts throughout the state and raise awareness that the contributions that artists make to society are just as important, if not more important, than the contributions of any doctor, lawyer, policeman, or fireman. So I think Ralph's presentation was terrific, but I'll take offense to his comment about art history majors. Even before the downturn in the economy, the arts community has been disproportionately impacted by things that have played out in Springfield. Our former governor, Blagojevich, made a $4.5 million cut to our state's arts council that was entirely politically motivated. Since the recessions hit, we've seen funding for our state arts council slashed by 63%. I'm not aware of any state agency that's had their budget cut by 63% in the last 2 to 3 years. That's had a big impact on those we serve and represent. The Arts Council, our state agency that provides grants and technical assistance to artists and arts groups, is really limited in their capacity. As a result of their diminished resources, we've seen arts organizations, both large and small, scale back in size and ambition, eliminate programs, cut performances, lay off workers, and many are teetering on the brink of existence. A lot of groups that were promised resources in this fiscal year are still waiting, and they're told that they'll be waiting for probably another 6 months. So as we move into fiscal year 11, there are groups that are still waiting on really modest resources from the state in FY10. So our sector is facing some enormous challenges, but it's also a sector that defines itself by being creative and innovative and working across silos. So that's a word about what's happening with the arts, and I think it's really important that this convening is taking place to focus not just on our own blinders and what's happening with those we represent, but what's happening across a variety of sectors.
Jack, I'd like you to address this.
Sure. Good morning, everyone. What I would say is, I think for human services, actually, Ralph, I thought kind of made our case very clear today. And as he mentioned, there's a full study of the decline, the real decline in funding that has occurred for human services over the last 10 years, coming to a total of, again, as Ralph mentioned, just taking into account population growth and inflation, we've seen over a $4 billion loss of support for human services. And we know, of course, that we're not just dealing right now with your increases in inflation, increases in population, but particularly in this environment, needs are greater. It's this simple. Whether you look at waiting lines, or you look at food pantries, you look at any program you choose, you know that there is higher demand right now, and so that we are continually faced with that what I call dichotomy of contracting resources at a time of increased demand for those services. So I think that's the environment that we see ourselves faced with. In the current budget, we're looking at somewhere over $200 million in human service proposed cuts in the budget. That's just based on the governor's proposed budget. And if the legislature was not to approve some of the borrowing and other measures that are recommended, we're really looking at much worse cuts to human services than what's even been proposed in what I would call a relatively draconian budget this year by the governor. So I guess I'll just leave it at that. I think that's how I see the human service environment right now.
Thank you. Philippe, I'm going to go with you next.
Good morning. Thank you very much to the Donor Ford Foundation and the other foundations for the invite today. Community health centers and the association I represent represent the Illinois Primary Health Care Association. Our mission, the mission of health centers, is to provide access to affordable, high-quality primary health care to people who don't normally or have easy access to the health care system, people who are uninsured, hard to reach, very low income. 90% of the patients that our members serve are at or below 20% of poverty, so they're very, very poor. We're a tale of two stories at this point. Given that healthcare reform is now the law of the land, there's going to be a major investment in the expansion of community health centers at the federal level. Just to give you a national perspective, though, and all this, Illinois is not the only one that has a weird way of budgeting. The major expansion at the federal level is coming out of a dedicated fund, and it's $11 billion, and it's over 5 years, and it's a national expansion. At the end of that 5 years, though, after you spend the $11 billion over those 5 federal fiscal years, there's a cliff where you then have to go back to Congress and say, okay, you now spend $11 billion. We need you to now fund that expansion starting at 2016 and beyond. So while they've made the investment, they've pushed off the real financing of the program into the out years, and so that gives you a little bit of a glimpse as to why we have a problem at the national level, and that it only makes things more complicated at the state level. Relative to the state level, health centers, their main concerns obviously is getting timely payment from Medicaid. 50% of health center revenues are derived from Medicaid today. That's a huge jump from where it was a few years ago, and the main reason has become what Ralph talked about this morning, is huge expansion of the Medicaid program to cover populations that have traditionally not been covered under Medicaid. So we're seeing those patients, more patient revenue for health centers is coming from Medicaid, when traditionally in Illinois, when the state is short of money, they elongate the payment cycle for Medicaid providers, and when you're 50% of your revenue is coming from Medicaid and you're not getting paid, that starts putting tremendous pressure on payroll. Basic things like payroll, paying the bills, keeping the lights on at your health center. The second thing I'll mention is we have had a program administered by the Illinois Department of Public Health since 2001 to expand community health centers. And I think someone asked about programs that have a high rate of return on investment. One of the things that the program does is it prepares communities to then go to the federal government and apply for federal community health center support to expand access to primary care. What we have found is that if you can prepare a community, you do the planning, you can get a site up and running with state funds, you position that site to be more competitive at the federal level. Well, that program in state fiscal 2007 was around $10 million. Under the governor's proposed budget for 2011, it's down to $3 million. It's taken sizable cuts, and now we're only being funded through tobacco settlement dollars. And actually, I was going to ask Ralph, but we got done with the questions. What's still on the table at the state level is to sell future proceeds of the tobacco settlement for a one-time infusion of cash. It's 1.3, 1.2 billion.
We oppose it, please.
Thank you. Good idea. Right. Good idea to oppose it. So for the grant program